Hello, future RNs. Every day, we dive into one high-yield topic that you must master for your NCLEX exam. And today, we're focusing on NCLEX pharmacology questions related to neurological disorders. These questions are frequently tested and can make or break your score. So stay with me till the end of this session, because it's packed with crucial concepts and rationales. Before we begin, I have something really exciting to share with you. We've created a shortcut to NCLEX success, our online NCLEX crash course. Whether you want to pass in just 7 days or 1 month, this course is built for you. Thousands of students have already enrolled, and they're passing with confidence. If you don't join now, you'll risk falling behind. Here's what you'll get inside: 100+ hours of animated crash course content, 500+ hours of high-yield video lectures, 5,000+ previously asked NCLEX questions, 15 full-length mock tests, complete NCLEX eBook, Next-Gen NCLEX, NGN, lectures and questions, 1-year access, and best of all, a 70% discount is running right now, but only for a limited time. The link to enroll is in the description box. Visit our website today and don't miss your chance to join this shortcut to NCLEX success. Now, let's jump into today's questions. A nurse is providing care to a 32-year-old client who suddenly becomes unresponsive and begins to exhibit generalized tonic-clonic movements lasting more than 60 seconds. The client's jaw is clenched, the body is rigid, and rhythmic jerking is noted in all extremities. The oxygen saturation has dropped to 86%, and cyanosis is observed around the lips. The fourth line is patent, and vital signs are being continuously monitored. Which of the following medications should the nurse anticipate administering immediately to halt the seizure activity and prevent progression to status epilepticus? A. Lorazepam. B. Phenytoin. C. Carbamazepine. D. Benztropine. Correct answer: A. Lorazepam. Let's move to rational. Lorazepam is a benzodiazepine and a first-line agent in the acute management of tonic-clonic seizures, especially when the seizure is prolonged or the client is at risk of status epilepticus. It acts quickly by enhancing GABA activity, providing rapid CNS depression and seizure cessation. Intravenous lorazepam has a faster onset and longer duration than diazepam, making it the preferred emergency medication. It should always be readily available in emergency seizure kits. Option B. Phenytoin is incorrect. Although phenytoin is an anticonvulsant, it is not the drug of choice for immediate seizure termination due to its slower onset. It is typically used for long-term seizure prophylaxis following initial seizure control. Option C. Carbamazepine is incorrect. This medication is also indicated for chronic seizure management, particularly in partial seizures, but it is not appropriate for emergent use. It lacks the rapid action needed for acute tonic-clonic seizure arrest. Option D. Benztropine is incorrect. Benztropine is an anticholinergic agent used to manage extrapyramidal symptoms, not seizures. It has no role in seizure management and could cause additional complications in the neurologically unstable patient. Here is key nursing concepts. In an acute seizure, protect the airway, ensure oxygen delivery, and administer intravenous benzodiazepines if available. Time the seizure and monitor for progression beyond 5 minutes. Postictally, assess for aspiration risk, neurologic status, and injuries due to convulsions. Be prepared to administer a second-line antiepileptic after the seizure stops to prevent recurrence. That was insightful. Now moving on to the next one. A nurse is evaluating a 76-year-old client diagnosed with moderate Alzheimer's disease who has been prescribed donepezil 10 milligrams orally at bedtime. During a routine assessment, the client reports feeling dizzy when getting out of bed and has a history of hypertension managed with metoprolol. Which of the following parameters is the highest priority for the nurse to monitor to ensure the client's safety during continued donepezil therapy? A. Fasting blood glucose. B. Pulse rate and rhythm. C. Total serum cholesterol. D. Oxygen saturation via pulse oximetry. Correct answer is option B, pulse rate and rhythm. Let's understand the rationale. Donepezil is a centrally acting acetylcholinesterase inhibitor used in Alzheimer's management. A known and potentially serious adverse effect is bradycardia, which may increase the risk of falls, syncope, and decreased cerebral perfusion, especially in older adults or those concurrently taking beta blockers like metoprolol. Monitoring the pulse rate and rhythm is critical for early detection of bradyarrhythmias and preventing injury. Option A, fasting blood glucose. Not a relevant parameter to monitor for this medication. Option C, cholesterol. Hyperlipidemia is not a known effect of donepezil, not clinically prioritized. Option D, pulse oximetry. More applicable to respiratory depressant drugs like opioids, not required for donepezil therapy. Let's keep the momentum going with the following case. A client with a severe traumatic brain injury is admitted to the intensive care unit. The latest neuroimaging confirms cerebral edema with rising intracranial pressure. The physician initiates pharmacologic management. Which medication should the nurse anticipate being prescribed to most effectively reduce intracranial pressure in this scenario? A. Hydrochlorothiazide. B. Spironolactone. C. Mannitol. D. Furosemide. Correct answer is option C. Mannitol. Mannitol is an osmotic diuretic that does not cross the blood-brain barrier, making it uniquely effective in managing elevated ICP. It creates an osmotic gradient that pulls water from the cerebral tissues into the vascular space, thereby reducing brain volume and pressure. This mechanism is essential in acute neurological injuries like TBI. A hydrochlorothiazide is a thiazide diuretic commonly used for systemic hypertension and peripheral edema. It does not influence cerebral edema and is ineffective in reducing ICP. B. Spironolactone, a potassium-sparing diuretic, is typically used in conditions like cirrhosis-related ascites and heart failure, not indicated for neurologic fluid shifts. D. Furosemide, though a potent loop diuretic, lacks the osmotic gradient mechanism necessary for rapid ICP reduction. Here is important clinical tip. Mannitol should always be administered intravenous with an inline filter to prevent infusion of any crystallized particles. Monitor closely for signs of fluid overload, such as pulmonary edema or heart failure, especially in clients with compromised cardiac function. Here comes another important question you should know. A nurse is conducting a follow-up assessment for a client recently initiated on Lamotrigine therapy for bipolar disorder. During the evaluation, the client reports several new symptoms. Which of the following findings warrants the nurse's immediate intervention and potential discontinuation of the medication? A. Reports of vivid, unsettling dreams disrupting sleep. B. Development of widespread erythematous vesicular skin lesions. C. Occasional post-meal upper abdominal discomfort. D. Complaints of persistent oral dryness and thirst. Correct answer. B. Development of widespread erythematous vesicular skin lesions. Let's look why this option is correct. The presence of vesicular, blister-like, lesions across the skin, especially if erythematous or painful, is a red flag for Stevens-Johnson syndrome, a rare but life-threatening dermatologic emergency associated with lamotrigine. It requires immediate discontinuation of the drug and urgent medical intervention due to the risk of rapid progression, mucocutaneous involvement, and potential systemic sepsis. Option A. Although vivid or abnormal dreams may occur with lamotrigine, they are a known non-life-threatening CNS side effect and do not require immediate discontinuation unless accompanied by psychiatric instability. Option C. Dyspepsia is a minor gastrointestinal side effect and can typically be managed symptomatically without discontinuing the medication. Option D. Xerostomia, dry mouth, is a common anticholinergic effect and, while uncomfortable, is not dangerous or urgent in comparison to the risk of SJS. Now, let's test your knowledge with the next situation. A nurse is monitoring a patient undergoing intravenous thrombolytic therapy with alteplase for an acute ischemic cerebrovascular accident. Which clinical observation most accurately indicates that the medication has achieved its intended therapeutic effect? A. A progressive improvement in the Glasgow Coma Scale score during neurological reassessment. B. Persistent expressive aphasia and unintelligible speech patterns. C. Evidence of minor mucosal bleeding along the gingival margins. D. Tachycardia, accompanied by a decreasing trend in systolic blood pressure. Correct answer is option A, a progressive improvement in the Glasgow Coma Scale score during neurological reassessment. Option A is correct because an increasing GCS score signifies neurological improvement and suggests that cerebral perfusion is being restored. An expected therapeutic outcome of alteplase in ischemic stroke management. Option B is incorrect. Unintelligible speech reflects ongoing neurological deficits, not a resolution of ischemic insult. Option C is incorrect. Although mild gingival bleeding can occur with TPA administration, it is a side effect, not a therapeutic indicator. Option D is incorrect. An elevated pulse and hypotension may be signs of internal hemorrhage, a life-threatening complication of thrombolytic therapy. Here is clinical insight. TPA, or alteplase, must be administered within a narrow therapeutic window after stroke onset, and careful neurological assessments must follow. Improvement in LOC, speech or motor function, as reflected in the GCS, is critical to gauging effectiveness. Always monitor for signs of bleeding and ensure invasive procedures are completed before initiating the infusion. Let's break down another commonly tested concept. A nurse is monitoring a client who has just received a subcutaneous dose of Sumatriptan for an acute migraine episode. During the post-administration assessment, which of the following findings is the highest priority and warrants immediate follow-up by the nurse? A. Blood pressure reading of 189/98 millimeters of mercury. B. Client reports persistent headache. C. Noted facial flushing and warmth. D. Complaints of mild nausea. Correct answer, A. Blood pressure. Reading of 189/98 millimeters of mercury. A. Blood pressure reading of 189/98 millimeters of mercury. Correct. This finding is clinically significant and requires urgent follow-up. Sumatriptan acts as a serotonin receptor agonist and causes vasoconstriction, which can dangerously elevate blood pressure. Clients with uncontrolled hypertension, coronary artery disease, or a history of stroke are at increased risk of cardiovascular complications with this medication. B. Client reports persistent headache. Incorrect. Although discomforting, the presence of a headache is the indication for which Sumatriptan is prescribed. Continued headache shortly after administration does not immediately signal an adverse reaction. C. Noted facial flushing and warmth. Incorrect. This is a well-documented side effect of Sumatriptan and usually transient. It does not indicate pathology and is not a reason for intervention unless accompanied by other alarming symptoms. D. Complaints of mild nausea. Incorrect. Nausea and gastrointestinal discomfort are known non-life-threatening adverse effects of the medication and do not require urgent intervention unless severe. Sumatriptan is contraindicated in clients with a history of uncontrolled hypertension, recent myocardial infarction, peripheral vascular disease, or cerebrovascular disease. Nurses must monitor for cardiovascular adverse effects, especially during initial administration. Routes of administration include oral, subcutaneous, or intranasal, depending on symptom severity and client tolerance. Let's build on what we've learned and look at the next question. A critically ill client is undergoing rapid sequence intubation in the emergency department. The primary healthcare provider prescribes Succinylcholine prior to endotracheal tube insertion. As the nurse prepares to administer the drug, which of the following best explains the primary therapeutic goal of administering Succinylcholine in this clinical context? A. To achieve sedation and minimize awareness during the intubation process. B. To reduce airway secretions and minimize aspiration risk during the procedure. C. To prevent bradycardia by attenuating a potential vagal response during intubation. D. To induce complete skeletal muscle paralysis to facilitate optimal laryngoscopic visualization. Correct answer, D. to induce complete skeletal muscle paralysis to facilitate optimal laryngoscopic visualization. Succinylcholine is a depolarizing neuromuscular blocker that causes rapid onset skeletal muscle paralysis, allowing easier insertion of the endotracheal tube during emergent intubation. While it facilitates mechanical control of the airway, it does not possess sedative, analgesic, or anticholinergic properties. Thus, sedation must be provided separately. Option A is incorrect. Sedatives such as propofol or midazolam are used for consciousness suppression. Succinylcholine has no sedative action. Option B is incorrect. Reduction of secretions is achieved with anticholinergic agents like atropine, not with neuromuscular blockers. Option C is incorrect. Succinylcholine does not influence vagal tone or heart rate. Atropine is the appropriate agent for vagal responses. Succinylcholine may cause transient fasciculations, hyperkalemia, or malignant hyperthermia. It is contraindicated in clients with existing hyperkalemia, neuromuscular disorders, or those with susceptibility to malignant hyperthermia. Let's move to next question. A nurse is caring for a client with a seizure disorder who has been maintained on a stable dose of Phenytoin. Recent laboratory testing reveals a Phenytoin serum concentration of 12 micrograms per milliliter. Which nursing action is most appropriate at this time? A. Initiate an adherence assessment to evaluate possible missed doses. B. Instruct the client to withhold the next dose and notify the health care provider. Conduct a focused assessment for central nervous system toxicity. D. Recognize the value as therapeutic and document the finding accordingly. Correct answer. D. Recognize the value as therapeutic and document the finding accordingly. Here is the rationale. A Phenytoin level of 12 micrograms per milliliter falls within the accepted therapeutic range of 10 to 20 micrograms per milliliter. Therefore, the appropriate nursing action is to document the result as expected. There is no clinical indication to evaluate for non-adherence. Choice A, withhold medication, choice B, or assess for toxicity, choice C, as these responses would be inappropriate in the context of a therapeutic drug level. Let's move to next question A. Nurse is evaluating the therapeutic and adverse effects of Sumatriptan in a client recently started on this medication for acute migraine relief. During a follow-up assessment, the client reports the following symptoms. Which findings should the nurse prioritize for immediate clinical evaluation as a potential serious adverse effect? A. Reports of nervousness and mild restlessness during use. B. Describes a transient warm flushing sensation post-administration. C. Complains of substernal chest pain and pressure radiating to the jaw. D. Mentions tingling sensations in the arms and fingers shortly after taking the dose. Correct answer. C. Complains of substernal chest pain and pressure radiating to the jaw. Reason behind this is that Sumatriptan is a selective serotonin receptor agonist, triptan, used for migraine management, but its vasoconstrictive properties can precipitate coronary vasospasm or myocardial ischemia, especially in clients with pre-existing cardiovascular conditions. Chest pain, angina, particularly radiating or pressure-like pain, must be treated as a potentially life-threatening adverse effect and demands immediate intervention. Option A, B, and D represent expected pharmacologic responses to Sumatriptan, such as transient nervousness, warm sensations, and paresthesia, tingling, which generally diminish over time with continued use. These do not typically require discontinuation of therapy. Let's move to next question. A 58-year-old male client is admitted to the ICU with signs of increased intracranial pressure following a traumatic brain injury. The healthcare provider prescribes an intravenous infusion of mannitol 20%. The nurse prepares to administer the medication. Which type of intravenous tubing is most appropriate to use for this infusion to ensure safe and effective delivery of the medication? A. Microdrip tubing to ensure accurate volume control. B. Filtered tubing to prevent potential crystallized particles from entering circulation. C. Vented tubing to allow air displacement in the infusion container. D. Non-vented tubing to maintain negative pressure within the container. Correct answer, B. Filtered tubing. Mannitol is an osmotic diuretic that can crystallize at lower temperatures, especially in highly concentrated solutions. To prevent embolic events or complications from particulate matter, IV mannitol must be administered through filtered tubing to ensure that any crystallized particles are trapped before reaching the patient. Choice A is incorrect because microdrip tubing is designed for precise volume control in pediatric or low-rate infusions, not for filtering particulate matter in hyperosmolar agents like mannitol. Choice C is incorrect. Vented tubing is used primarily for glass bottles or rigid containers to allow air entry as the fluid exits. It has no filtration capability and is not related to mannitol administration safety. Choice D is incorrect. Non-vented tubing is suitable for collapsible plastic containers and does not meet the filtering requirement for crystallized solutions like mannitol. Here is additional clinical insight for test takers. Mannitol is indicated for cerebral edema, elevated intracranial pressure, and in some cases acute renal failure, but only when adequate renal perfusion exists. Crystallization risk increases with low temperature, so always inspect the solution and warm if crystals are present, per institutional policy. Always monitor serum osmolality and electrolytes during therapy and target ICP levels between 10 to 15 millimeters of mercury in adults. Let's move to next question. A nurse is reviewing the medication list of a client newly diagnosed with seizure disorder. The provider has initiated Lamotrigine therapy. Based on the nurse's knowledge of pharmacological action, which condition is Lamotrigine most appropriately prescribed to treat? A. Management of autonomic dysfunction in acute spinal shock. B. Long-term suppression of epileptic seizures. C. Dopamine deficiency associated with Parkinsonian symptoms. D. Immune-mediated demyelination in multiple sclerosis. Correct answer, B. Long-term suppression of epileptic seizures. Here is rationale. Lamotrigine is primarily an anticonvulsant, used in the management of epilepsy and bipolar disorder. In epilepsy, it stabilizes neuronal membranes by inhibiting sodium channels, thereby reducing seizure activity. It is also a preferred option for women of childbearing age due to its favorable safety profile during pregnancy. Option A is incorrect. Acute spinal shock is managed using supportive therapy, sometimes including vasopressors like norepinephrine, but not anticonvulsants. Option C is incorrect. Parkinson's disease results from dopamine depletion, for which dopaminergic agents, not lamotrigine, are indicated. Option D is incorrect. Multiple sclerosis involves autoimmune destruction of myelin. Treatment often includes corticosteroids and immunomodulators, not lamotrigine. Let's move to next question. A nurse is reviewing the medication profile of a client recently diagnosed with narcolepsy. The nurse understands that the primary pharmacologic objective in managing this condition is to promote daytime alertness and reduce the risk of injury related to sudden sleep attacks. Which prescription would the nurse most likely expect the healthcare provider to order to achieve this therapeutic outcome? A. Trazodone. B. Modafinil. C. Diazepam. D. Fluoxetine. Correct answer, B. Modafinil. Let's look. The rationale. Narcolepsy is a chronic neurologic disorder marked by impaired regulation of the sleep-wake cycle, leading to sudden, uncontrollable episodes of sleep during daytime activities. The treatment objective is to enhance wakefulness during the day to prevent injury and improve function. Modafinil, a wakefulness-promoting agent and central nervous system stimulant, is commonly prescribed for this indication. It helps reduce excessive daytime sleepiness without the addictive potential of traditional stimulants. Option A, trazodone, and option C, diazepam, are sedative hypnotic agents that exacerbate drowsiness and are contraindicated in narcolepsy. Option D, fluoxetine, is a selective serotonin reuptake inhibitor used primarily for mood disorders. While it may have adjunctive benefits in some narcolepsy-related symptoms, such as cataplexy, it is not the first-line therapy for promoting wakefulness. Additional insight. Clients with narcolepsy may also experience cataplexy, a sudden loss of muscle tone often triggered by strong emotions, while consciousness remains intact. Safety precautions, including medication adherence and lifestyle modifications, are essential to reducing risks such as motor vehicle accidents and falls. Let's move to next question. A nurse educator is assessing the understanding of a group of nursing students during a pharmacology seminar focused on seizure management. The educator presents the following scenario. A 28-year-old client recently diagnosed with focal epilepsy is prescribed Phenytoin. You are providing discharge teaching and monitoring for therapeutic effectiveness and safety. Which of the following student statements most accurately reflects comprehensive understanding of Phenytoin therapy? A. Phenytoin is classified as a selective serotonin reuptake inhibitor, SSRI, and is frequently prescribed to manage seizure disorders. B. Maintaining phenytoin serum levels between 10 to 20 micrograms per milliliter is essential for therapeutic efficacy, and levels exceeding this range increase the risk for neurotoxicity. C. Phenytoin must be avoided in clients with Parkinson's disease because it can worsen tremors and rigidity. D. Phenytoin metabolism is hepatic and poses minimal risk for drug-drug interactions due to its limited involvement with liver enzymes. Option B is correct. Because phenytoin has a narrow therapeutic index, therapeutic levels must be kept within the 10 to 20 micrograms per milliliter range to ensure seizure control and prevent toxicity. Levels above this can cause adverse effects such as nystagmus, ataxia, and mental status changes. Option A is incorrect. Phenytoin is not an SSRI. It is a hydantoin anticonvulsant that works by stabilizing neuronal membranes and reducing excitability. Option C is incorrect. While phenytoin is not contraindicated in Parkinson's disease, caution may be needed due to potential extrapyramidal side effects, though this is not a direct or common contraindication. Option D is incorrect. Phenytoin is extensively metabolized by the cytochrome P450 enzyme system and is notorious for its numerous drug interactions, particularly with warfarin, oral contraceptives, and other anticonvulsants. Here is clinical tip. When initiating or adjusting Phenytoin therapy, monitor serum levels 6 to 12 hours after intravenous loading dose and again 2 weeks after starting oral therapy. Educate patients on signs of toxicity and the importance of adherence to dosing and routine level monitoring. Let's move to next question. Which medication on the list should prompt the nurse to immediately contact the primary healthcare provider for clarification or discontinuation? A. Haloperidol. B. Levodopa, carbidopa. C. Pramipexole. D. Ropinirole. Correct answer. A. Haloperidol. Let's look the rationale. Haloperidol is a first-generation, typical, antipsychotic that works by antagonizing dopamine receptors. Since Parkinson's disease involves a dopamine deficiency, the use of haloperidol may significantly worsen motor symptoms such as bradykinesia and rigidity. While psychotic symptoms may develop in Parkinson's disease, treatment should ideally involve atypical antipsychotics like quetiapine or pimavanserin, which have a lesser effect on dopamine pathways. On the other hand, levodopa-carbidopa is a cornerstone of Parkinson's therapy, and both pramipexole and Ropinirole are dopamine agonists that support dopaminergic activity. These are all appropriate and beneficial for symptom management in Parkinson's disease. Let's move to next question. An adult client recently diagnosed with mild to moderate Alzheimer's disease has just received the first prescribed dose of Rivastigmine. As the nurse evaluates the client's response to this acetylcholinesterase inhibitor, which clinical parameter requires ongoing and prioritized monitoring throughout therapy? A. Blood glucose level. Body weight. C. Serum creatinine. D. Hemoglobin and hematocrit levels. Correct answer is B. Body weight. Because rivastigmine, a cholinesterase inhibitor used in Alzheimer's-related dementia, is well documented to cause gastrointestinal side effects such as nausea, vomiting, and anorexia, leading to unintentional weight loss, which may be significant in elderly or frail individuals. Monitoring weight trends over time is essential to prevent malnutrition and adverse functional decline. A is incorrect. Blood glucose alterations are not pharmacologically linked to rivastigmine. and do not represent a primary concern with this agent unless coexisting diabetes warrants separate monitoring. C is incorrect. Renal function, reflected by serum creatinine, is not a specific or direct monitoring parameter for rivastigmine. Dose adjustments are not typically renal dependent. D is incorrect. Hemoglobin and hematocrit values are not affected by rivastigmine and are not included in the standard safety profile of this medication. Here is clinical insight. Rivastigmine is available in oral and transdermal formulations. It works by increasing acetylcholine levels through reversible cholinesterase inhibition. Nurses should anticipate bradycardia, GI symptoms, and weight loss as potential adverse effects requiring active surveillance, especially in older adults. Let's move to next question. A nurse in the neurological intensive care unit is preparing to administer an intravenous infusion of Phenytoin to a client recently diagnosed with generalized tonic-clonic seizures. The healthcare provider has ordered a loading dose of intravenous Phenytoin. Prior to initiating the infusion, which critical nursing intervention must be implemented to ensure safe administration and reduce the risk of life-threatening complications? A. Initiate continuous cardiac monitoring to detect potential dysrhythmias associated with intravenous Phenytoin. B. Draw a peak serum Phenytoin level to evaluate therapeutic drug concentration before administration. C. Begin continuous electroencephalographic EEG monitoring to localize seizure foci during drug infusion. D. Insert a Foley catheter to monitor fluid output during the administration period. Correct answer. A. Let's see rationale behind to it. Intravenous Phenytoin administration carries a significant risk of cardiac toxicity, including bradyarrhythmias and heart block. Continuous cardiac monitoring is essential during infusion to detect these complications early. Additionally, Phenytoin is a vesicant requiring a patent, large bore IV line. Option B is incorrect because serum trough levels, not peak, are measured prior to the next dose for therapeutic monitoring. Option C is inappropriate. EEG monitoring is not required during drug infusion unless seizures are ongoing or localization is needed. Option D is not a standard precaution with Phenytoin. Urine output monitoring via catheter is not necessary unless other conditions warrant it. Clinical tip. Phenytoin is preferred in many settings due to its safer cardiovascular profile and lower risk of extravasation. Let's move to the next question. A client newly diagnosed with Parkinson's disease has been prescribed Ropinirole. During medication education, the nurse prioritizes assessing the client's understanding of the drug's purpose. Which client statement indicates a correct understanding of this prescription? A. This medication will help prevent the progression of my multiple sclerosis. B. This drug helps improve my dopamine levels to reduce my tremors and stiffness. C. This medication is supposed to control the hallucinations I've been experiencing. D. This drug will help reverse the nerve damage caused by Guillain-Barré syndrome. Correct answer is B. Ropinirole is a dopamine agonist, primarily used to treat Parkinson's disease by stimulating dopamine receptors in the brain, helping reduce motor symptoms like tremors, rigidity, and bradykinesia. While also indicated for restless leg syndrome, it is not appropriate for conditions such as multiple sclerosis, treated with immunomodulators like interferons, schizophrenia, where increased dopamine worsens symptoms, or Guillain-Barré syndrome, treated with IV immunoglobulin or plasmapheresis. Let's move to next question. A nurse is evaluating the therapeutic efficacy of carbamazepine in a client recently diagnosed with a mood disorder characterized by emotional instability. Which clinical observation would most strongly suggest that the client is exhibiting a desired pharmacologic response to this medication? A. The client demonstrates improved mood regulation with fewer emotional fluctuations during interpersonal interactions. B. The client maintains balance while ambulating across the room without signs of unsteadiness. C. The client reports no episodes of urinary urgency or incontinence during the shift. D. The client's recent bone density scan reveals increased trabecular bone mass compared to baseline. Correct answer Now we will discuss the rationale behind this. Carbamazepine is classified as an anticonvulsant that is also used off-label as a mood stabilizer, especially in the treatment of bipolar disorder and mood lability. A reduction in emotional volatility, reflected by improved mood regulation, is a direct indicator of therapeutic effectiveness. Options B, C, and D reflect physiologic parameters unrelated to the drug's intended psychiatric indications. While neurological side effects like ataxia, unsteady gait, may be adverse effects of carbamazepine, their absence does not indicate therapeutic efficacy. Additionally, carbamazepine has no effect on urinary continence or bone density enhancement. Here is clinical insight. Carbamazepine use requires ongoing complete blood count, CBC, monitoring due to risk of blood dyscrasias, e.g., agranulocytosis, aplastic anemia. Women of reproductive age must be counseled on teratogenic risks, especially neural tube defects, and advised on effective contraception. It is also known to have multiple drug interactions due to its enzyme-inducing properties. Let's move to next question. A nurse is conducting a comprehensive medication reconciliation for a hospitalized client currently receiving Phenytoin therapy. Which of the following concurrent prescriptions should prompt the nurse to immediately consult the healthcare provider due to a potentially harmful interaction? A. Thiamine. B. Hypericum perforatum. C. Warfarin. D. Acyclovir. Correct answer. C. Warfarin. Here is rationale. Phenytoin and warfarin are both highly protein-bound medications. When administered together, phenytoin can displace warfarin from protein-binding sites, leading to enhanced anticoagulant effects and increasing the client's risk of bleeding. Due to this significant pharmacokinetic interaction, the nurse should question the simultaneous use of these medications and alert the healthcare provider. Option A. Thiamine is incorrect. Thiamine, a vitamin B1 supplement, is commonly used in clients with chronic alcohol use or malnutrition to prevent Wernicke's encephalopathy. It does not interact with phenytoin and poses no additional risk in this context. Option B, Hypericum perforatum, St. John's wort, is incorrect. Although St. John's wort is contraindicated with certain serotonergic agents due to the risk of serotonin syndrome, it has no clinically significant interaction with phenytoin. Option D, acyclovir, is incorrect. Acyclovir is an antiviral medication primarily used to treat herpes simplex and varicella zoster infections. It has no known interaction with phenytoin, and co-administration is generally considered safe. Let's move to next question. A nurse is evaluating the laboratory findings of a client with a known history of epilepsy, who is currently receiving valproic acid therapy. The client's serum VPA level is reported as 40 micrograms per milliliter. Which nursing action is most appropriate based on this laboratory result? A. Initiate a focused assessment on the client's medication adherence practices and document findings for interdisciplinary follow-up. B. Instruct the client to withhold the next scheduled dose of valproic acid until further laboratory results are obtained. Notify the healthcare provider immediately for signs of acute VPA toxicity and prepare for emergency intervention. D. Document the VPA level as therapeutic and proceed with the routine medication schedule. Correct answer. A. Initiate a focused assessment on the client's medication adherence practices and document findings for interdisciplinary follow-up. Rationale: a VPA level of 40 micrograms per milliliter is subtherapeutic and increases the risk of seizure recurrence. The most likely explanation in a compliant patient without recent dose adjustment may include poor adherence. The nurse should prioritize assessing medication compliance and communicating these findings to the healthcare team. Option B is incorrect because skipping a dose may further lower serum VPA levels and increase seizure risk. Option C is inappropriate as toxicity would be expected with elevated, not reduced, VPA levels. Option D is incorrect because a level of 40 micrograms per milliliter is clearly below the therapeutic range and should not be considered normal. Clinical insight: Valproic acid is a broad-spectrum anticonvulsant, also used in bipolar disorder and migraine prophylaxis. Common adverse effects include gastrointestinal upset, alopecia, hepatotoxicity, and hematologic abnormalities. Liver function tests and VPA levels should be routinely monitored to assess safety and effectiveness. Let's move to next question. A nurse is providing discharge education to a client newly prescribed Phenytoin for seizure control. Which of the following client statements reflects the most accurate understanding of the medication regimen and safety considerations? A. If I notice my gums becoming swollen or irritated, I should discontinue the medication immediately. B. I understand that I'll require periodic blood tests to ensure my Phenytoin levels remain within a safe and therapeutic range. C. If I experience another seizure, I can double the dose of this medication for better control. D. I'll make sure to take this medication only with meals that are low in protein to enhance absorption. Correct answer. B. Rationale. Option B demonstrates an appropriate understanding of Phenytoin therapy. Phenytoin has a narrow therapeutic index, making regular serum level monitoring essential to prevent toxicity or subtherapeutic dosing. Options A, C, and D are incorrect. A. Gingival hyperplasia is a known side effect of Phenytoin, but does not warrant abrupt discontinuation. The patient should be advised to report this and maintain meticulous oral hygiene. C. Medication dosage adjustments should only be made by the prescribing provider. Doubling the dose independently poses a risk of toxicity and seizures. D. Phenytoin can be taken with or without food, and there is no specific protein restriction related to its administration. Let's move to next question. A nurse is evaluating the effectiveness of tizanidine therapy in a client recently diagnosed with multiple sclerosis. Which client statement most accurately reflects a therapeutic response to this medication? A. I'm finally able to concentrate and follow conversations better. B. The muscle spasms in my legs are noticeably reduced. C. I feel like my memory is coming back, especially for recent events. D. I can now sleep through the night without waking up repeatedly. Correct answer is option B. Tizanidine is a centrally acting alpha, 2-adrenergic agonist used primarily as a muscle relaxant. Its therapeutic goal in clients with conditions like multiple sclerosis is the reduction of muscle spasticity and spasms. Therefore, option B is the best indicator that the drug is achieving its intended effect. Option A is incorrect. While improved concentration might occur due to reduced discomfort, it is not a direct pharmacologic target of tizanidine. Option C is incorrect. The medication has no known cognitive enhancing effects. Option D is incorrect. Although improved sleep may be a secondary benefit due to reduced pain or spasms, it is not a reliable or specific indicator of therapeutic action. Clinical insight for NCLEX. When evaluating drug effectiveness, especially in neurological or muscular disorders, focus on primary symptom control. In this case, assessing a functional improvement in mobility or a decrease in involuntary muscle activity offers the most direct evidence of therapeutic action. Let's move to next question. A nurse is preparing to administer intravenous midazolam to a client, as per standing orders, for acute behavioral and neurological stabilization. Before giving the medication, the nurse reviews the client's current status and observes the following. First, the client is intermittently aggressive and agitated. Next, the arterial blood gas report shows pH of 7.28, partial pressure of carbon dioxide of 58 millimeters of mercury, and bicarbonate, or HCO3, at 25 milliequivalents per liter. The client also has a history of cocaine use, and current symptoms are suggestive of intoxication. Additionally, there is a documented history of generalized tonic-clonic seizures. Which of the following findings would require immediate clarification with the healthcare provider prior to medication administration? A. Acute cocaine intoxication with psychomotor agitation. Blood arterial blood gas, indicative of uncompensated respiratory acidosis. Chapter History of tonic-clonic seizure activity. D. ongoing aggressive behavior and verbal threats to staff. Correct answer, B, arterial blood gas, indicative of uncompensated respiratory acidosis. Here is rationale. Midazolam, a CNS depressant and benzodiazepine, has known adverse effects, including respiratory depression and hypoventilation. Administering this drug to a client already experiencing respiratory acidosis, elevated PaCO2 and decreased pH, may worsen the condition by further reducing respiratory drive and promoting CO2 retention. This finding requires immediate physician notification to reassess safety before proceeding. A is incorrect. Cocaine intoxication frequently results in CNS overstimulation, and benzodiazepines like midazolam are commonly used for symptomatic control of agitation and potential seizure prevention. This is an appropriate and evidence-supported use. C is incorrect. Tonic-clonic seizures are often managed acutely with benzodiazepines. Midazolam is effective for aborting seizure activity and is an appropriate therapeutic agent in this context. D is incorrect. Aggressive and violent behavior can be pharmacologically managed using sedative agents, such as midazolam, especially when the patient poses a risk to self or others. No contraindication exists here that requires physician clarification. Key clinical insights. Pharmacologic profile of midazolam, rapid onset benzodiazepine used in emergency management of seizures, sedation, and behavioral dysregulation. Major concern, respiratory compromise, especially in clients with pre-existing pulmonary or acid-base disorders. Antidote, flumazenil, should be readily available in case of overdose or severe respiratory depression. Nursing priority, assess for any signs of respiratory insufficiency or acidosis prior to administration. Clarify orders when physiologic parameters, like ABGs, indicate elevated risk. Let's move to next question. A nurse is evaluating a newly prescribed medication order for Sumatriptan in a client presenting with recurrent episodes of unilateral, throbbing headaches, accompanied by photophobia and nausea. Based on the therapeutic use of this medication, the nurse should recognize that Sumatriptan is primarily indicated for the management of which of the following conditions? A. Peripheral arterial occlusive disease. B. Hypertensive emergency. C. Acute migraine episodes. D. Vasospastic angina. Prinz metal angina. Correct answer. C. Acute migraine episodes. Sumatriptan is a selective serotonin receptor agonist used as abortive therapy for migraine attacks. It is not utilized for migraine prophylaxis, but is effective in relieving headache symptoms once a migraine has begun. Option A, peripheral arterial disease, PAD, is a contraindication to Sumatriptan due to the risk of vasoconstriction and potential for cardiac ischemia, especially in patients with compromised vascular status. Option B, the drug is contraindicated in clients with uncontrolled hypertension, as it can provoke coronary vasospasm and exacerbate blood pressure levels. Option D, Sumatriptan may cause chest pressure or pain, especially in individuals with coronary artery disease or vasospastic angina, e.g., Prinz metal angina, making it contraindicated in such cases. Clinical pearls for NCLEX. Success. Mechanism of action. Sumatriptan acts on cranial blood vessels to cause vasoconstriction and suppress inflammation in migraine pathways. Route and sensory effects may be administered subcutaneously or intranasally. Patients often report a warm, tingling sensation after injection. This is expected and transient. Key monitoring points. Watch for serotonin syndrome, elevated blood pressure, and neuropsychiatric changes, particularly if combined with other serotonergic agents. Common side effects: nausea, dizziness, flushing, gastric upset. Reassure patient these are common and typically self-limiting. Absolute contraindications: history of stroke, myocardial infarction, coronary artery disease, uncontrolled hypertension, or vascular disease. And that wraps up today's NCLEX review on neurological pharmacology questions. Great job sticking with me. Remember, NCLEX isn't about how much you know. It's about knowing what matters most to the exam. And you're doing exactly that by showing up every day. Here's your next step. If you found this helpful, imagine how powerful it would be to have a full crash course where every single topic is explained this clearly, with thousands of past NCLEX questions, detailed rationales, and animated video lectures. That's exactly what we've built for you inside the Stancoast Online NCLEX Crash Course. It's your shortcut to passing in just 7 days or 1 month. Over 5,000 students have already enrolled and are now licensed nurses. And yes, 70% discount is available for a limited time only. Visit the link in the description to enroll today. This is your moment. Don't wait, or you'll be watching others pass while you're still searching for answers. And one last thing. We upload high-yield NCLEX videos like this every single day. So hit that subscribe button, turn on notifications, and never miss a chance to move closer to your RN license. Thank you for learning with me. And I'll see you tomorrow with another must-know NCLEX topic.